gentleman from Texas, Mr. Crenshaw, for his 5 minutes of questioning.
Thank you, Mr. Chairman. Thank you, everyone, for being here. Ms. Gay, when we talk about Medicare and Medicaid, we're not talking about just paperwork errors, right? We're talking about really actual people being harmed, whether those are seniors, kids, or the disabled. And your experience when it comes to fraud in federal health care programs, it's not a victimless crime, is it? It directly harms beneficiaries. So I mean, just drawing on your experience across Medicare, Medicaid, and the commercial plans, why is it that Medicare and Medicaid are so much more vulnerable to fraud than private insurance? Look, fraud is a crime, also waste. I like to differentiate between these two terms.
Sure.
But both.
Yeah, I mean, I think one, there's just scope and span. Medicaid in particular is difficult because each plan has varying regulations and guidance, as well as benefit coverage determinations. So it gets more difficult at the state level. There's a saying, if you've worked for one Medicaid plan, you've worked for one Medicaid plan. And so that certainly offers some challenges there. I think there's also, I don't know, personally I can say I don't often read my EOBs, but I think, that goes down too in certain populations whether they don't have access to a computer, they don't even mail these EOBs out. We talked a little about the homeless population. Where would that go? I'm not exactly sure. So do you even know what's being billed under your Medicaid or your Medicare number? It's just a difficult process to wrap around. It's complicated from a data standpoint.
Yeah, and I think that the more we waste on people who really are not even eligible for it in the first place, the less space there is for people it's designed for. That doesn't get said enough. And that gets to my next question. I mean, who really bears the brunt of the harm? Is it the system? I mean, yeah, a little bit, right? Because the taxpayers are on the hook, so the system is hurt. But it's really the patient. For all the reasons we just stated, right?
Absolutely.
Can their care become delayed, or we've heard of providers just won't even take Medicaid anymore. Now, so what's the solution here? I mean, some argue stronger oversight would actually threaten access to care. But based on your experience, what actually happens when fraud is not controlled? That gets to, again, who bears the brunt of this?
Yeah, I mean, I think there's certainly the patient harm attribute. You mentioned, not getting the care that you need, and Ms. Wooten brought up, SUD treatment facilities, and we dealt with some cases with ACA enrollments, and by the time we verified with CMS that those were eligible recipients, the health plan was already on the hook for $1, $2, $3 million. Were these patients even receiving the care? In some cases, yes. In other cases, they had no idea that they were in a facility for such treatment. And I think to Ms. Wooten's point with having that stigma, now you have somebody that doesn't even have that challenge, but that is now on their record. And even worse, those that do, that are getting subpar treatment at a very exorbitant rate and still not getting better.